All right, we're almost at five after. I'm going to go ahead and just get started. And, people can continue trickling in. Hello, everyone. My name is Alicia Anderson. I am the Athena Mosaic Pillar Lead. One of the Pillar Leads, Shanita Moore, is also a Pillar Lead. She is actually on site at a client's office. But thank you so much for joining our Black History Month event, our keynote event for Athena Nation. First, before I introduce Dr. Setor Zilevu. Want to make sure I get that right. I've been practicing all morning. We want to encourage everyone to please, please, please put all questions in the chat. We want to have a very, very lively discussion. Our team, Athena Mosaic colleague Heather Abbott, will be monitoring the chat. I'll also put in the link, in the chat, our survey. So at the end, please, please, please fill that out so that we can continue bringing you guys great programming. Okay, so to get started, thank you everyone, like I said, for joining us for our Black History Month event. I would like to introduce Dr. Setor Zilevu. He is a principal researcher specializing in the intersection of AI, human-computer interaction, and UX research. He has led product research in Meta's Superintelligence Lab and created and taught courses on UX for AI and applied UX research at NYU. Dr. Zilevu holds a PhD from Virginia Tech, where his research on stroke rehabilitation led to one of the world's first cyberhuman stroke systems. His work has implemented at Shirley Ryan Ability Lab, one of the world's top rehabilitation hospitals, and received $5 million in grant funding. He was named MIT Technology Review Innovator Under 35 for developing pioneer cyber human systems and creating a novel methodology for understanding how human mind works in relation to AI systems. Through his frameworks and teachings, Dr. Zilevu has focused on building assistive AI technologies that augment clinical judgment, center patient agency in healthcare. Wow. Thank you, thank you, thank you, Dr. Zilevu. Welcome, welcome, welcome to Athena, to, like I said, to our Athena Mosaic Black History Month event.
Thank you for
So
having me. I'm super excited to be here.
yes, yes, yes. So to start us off, can you share what first drew you in the intersection of AI, healthcare, and equality? Was there a moment or experience that made gaps in the system feel personal to you?
Yeah, to be honest, I never thought I would be working at this intersection. I actually wanted to stay away from tech entirely. So my plan was actually to be a neurosurgeon, but that
Mm.
dream quickly faded away. Yeah, when I realized that I was afraid of both blood and needles. So I decided to pivot, and I majored in computer engineering. But what really drew me back into healthcare was that right before my undergrad graduation, my dad unfortunately had a stroke. And when he had a stroke, that changed everything for me. And I remember I spent that summer with him and my family really trying to understand how we navigate the recovery process. And what I saw frustrated me deeply. Like I saw different doctors and therapists giving my dad conflicting opinions about his care. I saw the burden of like coordinating hospital visits, the time, the transportation, the cost.
Mhm.
And for me, despite all of those efforts, I realized that he wasn't getting personalized care and it wasn't tailored to him. And so it was whatever the systems could offer at the time. And I began to ask myself, honestly, why does the quality of care someone receives, why does it depend so much on where they live or what they can afford and who they know? And this is what really started to pull me into this work. And this early frustration became my obsession, to be honest. I started researching how do we create assistive technology that actually levels the playing field? How do we give people the same level of access to highly personalized, like expert care, regardless of their resources? And this is what really started to push me deep into human computer interaction and where I created the interactive apps for stroke survivors. And so one of the first apps I created allowed for patients to ultimately reclaim their agency and to be able to receive high level care from their comfort of their home. So, really removing the barriers of transportation and cost to making sure that patients like my dad weren't limited to geography or income. And from there, I just took it deeper and I just honestly started to understand the relationship between the human mind, healthcare, and cyberhuman systems. And that's where I developed like the Z framework that could really focus on capturing implicit expert knowledge from like the best clinicians in the world. So really here I was focused on understanding how they think, how they assess, how they make decisions, and standardizing that knowledge so that every patient, regardless of where they are, could receive the same caliber of care. And that's what led to the cyberhuman systems and really just my work at this intersection. So when I think back and I reflect, I didn't choose this intersection. I would say more so chose me. And watching my father go through his stroke recovery, I saw how the systems work for some people and not others. And that was such a huge gap to me that I decided I was going to build technology that helped close it. I think you're muted.
Someone muted me instead of everyone else. No problem. Okay, great. So one of the next questions we wanted to talk about was your work, right? And your
Mhm.
work frequently emphasizes that AI augment human intelligence rather than replace it. In the contents of healthcare, what does it look like in practice, especially for underserved communities?
Yeah, that's a great question. Um, In practice, I would say it starts with a mindset shift. It means we
Mhm.
stop building for the majority with the hopes that eventually the benefits trickle down. And it means that in AI for healthcare, we're intentionally designing and prioritizing first underserved communities. And this is not an afterthought. And this was honestly one of the core catalysts behind why I developed the Z framework, because it really focuses on capturing implicit signals for how we think and how we come to conclusions. Because a premise that I believe is that AI shouldn't just hand us the answer. It should take our own implicit human knowledge, make it explicit, and allow us to utilize it in a way that really focuses on advancing our own thinking and calling out our blind spots versus us just solely relying on AI for its input. And when
Mhm.
we think about underserved communities, getting this right is especially critical because the alternative is dangerous. When AI replaces human judgment instead of augmenting it, it's going to disproportionately harm the very people who it's meant to represent. And if the training data doesn't represent people that look like me or you, the data is not going to, the systems that we build aren't going to support us. And to be honest, here's what like keeps me up at night when I think about where we are when it comes to AI assistants and also AI agents, especially in healthcare. I've been thinking very deeply about like how do we rebuild a new paradigm so we're using AI in a way that sharpens our thinking versus making us over reliant on these tools. And there was a recent study that came out from one of the top AI labs around AI skill formation that I think everyone in healthcare and everyone in this room should be paying attention to. And what they found was that when people fully delegated tasks to AI, they scored 17% lower in comprehension. But the
Mhm.
people who performed the best was when they used AI to ask questions to deepen your understanding and not to replace your own thinking. And when I think about this, the parallels to healthcare is direct. If clinicians start to become over reliant on AI generated summaries and stop exercising their own clinical judgment, we're going to lose the very expertise we need to catch when AI gets it wrong. And AI is going to get it wrong more often for marginalized patients because we're the ones with less data, more complexities, and also more at stake. And so in practice, for me, it's really thinking through how do we build systems where humans and AI are truly collaborators rather than creating a
Mhm.
dynamic where we are just blindly deferring to the machine. And so that was one of the core premises for why I developed the Z framework is for us to focus on us allowing AI not to just do the thinking for us, but instead we use it in a way that makes us better thinkers. And as in healthcare and in AI, as it becomes more integrated into our workflows, this to me is not something that should be a nice to have. I really think this is going to make the difference between life or death for many people.
So I'm going to divert a little bit and piggyback off something you said. That Z framework, right?
Yes.
Can you talk, because us being Athenistas being healthcare tech, and like we've discussed, we're very AI forward. Can you tell us a little bit about that Z framework, and in terms that we might understand?
Yeah,
Someone
definitely.
who's can, if you could tell us a little bit about that, because that sounds really really interesting to me. So if you can kind of just give us a little bit more insight on when you say you developed that Z framework.
Yes. So the Z framework, it stemmed from when I was going to hospital visits with my father and noticing that there are so many different nuance advice and information that different doctors were giving him. And I noticed
Hmm.
that there was a lot of like implicit signals that aren't captured. When we think a lot
Hmm.
about how AI works today, right, it captures so many different data points to use it to inform the answers that it gives. But we are humans are very nuanced, and there are so many implicit things that we think about, so many implicit signals that we go through and nuances that is not just captured in data, that just lives in our mind. And
Hmm.
so in healthcare, especially for like giving feedback in assistive care, I wanted to create a standardized way in which we can take those signals that separates out what makes someone a good doctor versus a great doctor and really put it on paper.
Hmm.
So that way, one, it helps train everyone to have the same standardized approach to how they give feedback and care. But two, also, it makes the systems that we're developing more personalized and more tailored towards patient. And so what it really focused on, which was a very challenging problem, was understanding the mental model and the signals that matter most to therapists and doctors, really thinking through all these 16 million combinations, which ones are most problem for giving the best results for patients, and really creating a framework that starts to capture that knowledge in a way that is novel. Because when we look at current AI tools and systems today, it's just pulling from the data that's around us versus everyone in this room has
Hmm.
very implicit nuances for how they think, how they work. The Z framework, in a way, is a standardized approach to capture that framework to train machine learning models.
Great, great. Yeah, everyone, you, I don't know if you can see it or not, but the chat is very lively about that. Um, okay, so we often talk about AI serving patients, right? But
Mhm.
really about patients shaping AI. How do you think, how do you think about giving communities, especially historically marginalized ones, real agency in how health AI is designed and deployed?
Can you repeat that? I think you broke up for a bit.
Did I break up? I'm sorry. Okay,
Yeah,
so I'll start from the beginning.
yeah,
When we talk about AI serving patients, but we really talk about patients shaping AI.
yes.
How do you think, how do you think about giving communities, especially historically marginalized ones, real agency in how health AI is designed and deployed?
Let me think about that because that's a really good question. Um, I would say this is something I don't think we're spending nearly enough time talking about, right?
Mm,
Because when I look at most of the conversations around AI and healthcare, it really flows from tech companies to providers. And what I would really love to see more is for these conversations to be centered around the patient experience. Because what I've
mm,
noticed is that the patient is the last to know and the last to have a say. And ironically, they're the most important person in their entire equation. And I'll share something personal that brought this home for me. I recently took my dad to see a new doctor and someone who we've never been to before. And the
mhm,
doctor was reviewing options and he suggested two new medications based off of my dad's history, saying they'll
mhm,
be effective given that he's previously had a stroke and a heart attack. I remember looking at my dad, he's also looking at me, and we're both kind of confused because he's never had a heart attack. And
mm,
when we asked the doctor where that came from, he told us he was using an AI-powered patient summary. And that scared me for two reasons.
mhm,
Because one, the AI got it wrong. It put a heart attack in my father's history, and that never happened. And two, my dad had absolutely no visibility into what the AI was saying about him. He had no way to review it, no way to correct it.
mhm,
He didn't even know it existed until the doctor prescribed medication based off of it. And so I remember my dad looked at the doctor and said, like, why don't I have control to see what this says about me? Because
mhm.
what kept running through my mind was that what if we didn't catch it? What
Right.
medication would my father be on right now based on a condition that he never had? And so that really led me to really think deeply about how are we ensuring that the patients are shaping the outcomes AI provides for them versus not just receiving it. And I think there's a massive behavioral shift happening right now that we need to pay attention to. Patients are sitting in hospital waiting rooms at home and they're just feeding medical histories and test results into generative AI tools. And
Mm,
the reason why they're doing that is because they want to understand what the doctors are telling them. And this behavior to me really signals like a flashing warning sign because it tells me that patients are starved for comprehension, for agency, and they're really trying to level the playing field. And when I think about for historically marginalized communities, I think the stakes are even higher because We're
Mhm.
either going to enter the clinic with either blind trust or deep historical justified skepticism. And if we want to
Mhm.
give real agency, we need to bring people from these communities into the design process of step zero. We need to really think about how we're going to build out systems that demystify the medical experience and give patients visibility into AI's conclusions. And this is where I think the focus should be on is really understanding how are we researching, designing, and building and understanding the nuance of patients' needs from the very beginning and really thinking about what it looks like to put the patients at the very center of the process from the very beginning and not necessarily through the lens of a feedback survey after the product ships or thinking
Right.
about it as an afterthought. Like this needs to be a deliberate design input from day one.
Yeah, no, that's a great point because I mean, and I also think about like how from a patient perspective, especially in the marginalized community, like the education part, right? Because, you know, there's sometimes even think about like when COVID happened, a lot of the marginalized communities, the schools weren't equipped, right, to be able to, supply the kids with the right internet and then and the right education. So then I think about now with AI, like how do we, ensure that there's education in those communities, to your point of, unfortunately what happened with your doctor, thank God he had you there, right, to be
Yeah.
able to, talk
Yeah.
through that. But that's pretty scary. So that brings me to a little bit of my next question. We sit at a unique intersection of technology and frontline care, supporting clinicians, staff, and patients at scale. When you think of about AI in healthcare, where do you see the biggest opportunities to reduce friction without losing the human connection that equity care requires?
I think when I look at this, and I'm going to look at this from the lens of like Athena Health specifically, I
Mhm.
think Athena Health sits in a really powerful position right now. You all are powering the infrastructure that many clinicians, patients are going to be interacting with every single day at scale. And to me, that is such an enormous responsibility, but also an enormous opportunity. And I see two major opportunities here. Is one is to reduce the friction, like administrative burden. So documentation, scheduling, like part authorizations, all the things that eat up a clinician's time. Because one thing that I've learned through my research is that every minute a doctor spends trying to understand a new system, like input data, it's a minute away they're not actually listening and spending time with the patients. And for
Yep.
patients from underserved communities, like trust is harder to build and it's also easier to lose. And so those minutes matter even more. And we really want more time with our doctors for them to really understand like our unique cases. But there's a critical tension here. And I think this is where companies have to be really intentional, and is that in the pursuit of efficiency, there's a real risk of automating away the moments that matter most. And in those moments, they don't always show up in efficiency metrics, but that's where I think equitable care actually lives.
Mhm.
Now, also, there's a second opportunity too that I'm also seeing, which is that this is where I think healthcare companies need to start, to be honest, thinking ahead. And that is
Mhm.
as it relates to AI agents. We're entered into an era where AI won't just assist with tasks, but is going to execute workflows autonomously. And this is going to raise a really, really important question for healthcare, which is where does the human stay in the loop? And also,
Mhm.
where might the human need to move above the loop? And right now, what I really see a lot of talk about is about keeping the human in the loop for like verifying care plans or for checking diagnostic codes. But as we move forward, we have to start thinking about the experiences and risks when the human is above the loop, where they're actually governing the AI rather than just micromanaging it. And I think
Mhm.
this opportunity for tech companies is that they have the ability now, the resource, the technology, the tech stack sits there now where we can create proactive agentic systems that anticipates a patient's social needs before they walk into a clinic. We can imagine a world where we have dynamic interfaces that adapt in real time to like a patient-specific health literacy level, right? And continuous feedback channels where marginalized communities can directly flag when these systems aren't serving them. But we need to be really careful about how we think about designing these systems because we could create a world where neither the clinicians nor the patients fully understand what the agent did on their behalf, and in healthcare, that is
Mhm.
dangerous. So though the opportunity is massive, I think it needs to be designed with transparency and with the patient at the center, and not just thinking about how do we use agents to just optimize workflow. So there's so much nuance in that that I think we have to untangle first. But this is a huge opportunity on the horizon that I really want healthcare to capture.
I wonder if those principles and that feedback that you just gave, it had me thinking like how are medical schools, leveraging AI in that sense, right?
Yeah.
Because to me, I almost think that's where it kind of starts, as
Hmm.
far as that training, and not just that human interaction, but using technology to, leverage that equitable care. So
Yeah.
wonder how that's being done. But okay, so moving along. So representation matters, right? Not just
Hmm.
in data, but in who's designing, deploying, and governing AI. How does diversity within tech and healthcare organizations shape better outcomes? And where do you think companies still fall short?
I love this question, especially as we're celebrating Black History Month, because it forces us to think about representation, not just to hit a quota, but to actually evaluate what it means in practice. And it's about, to me, what gets built, and more importantly, what gets missed when certain people aren't in the room. We as
Mhm,
Black technologists and researchers bring a lived experience that fundamentally changes the architecture of what we build. And I think diversity in tech is really important. And I've got an early glimpse of this during like my years at school, where there was one instance where we were testing one of the demos and it kept failing when it came to me. And it kept telling me that I wasn't performing the exercises correctly. And I was shocked because I'm a fully able person and
mhm.
it can't track my movements. And so being the researcher that I am, like I dug into the data and I found the problem. And it was that the system hadn't been trained to recognize black skin. So it accurately
Wow.
couldn't read my movements because the training data didn't include people who look like me. And so I saw this as an opportunity to work with the research on the project to figure out one, how do we fix the issue, but also take this as an opportunity, as a learning moment. And
Mhm,
so what stuck with me when I really reflect on that is that I caught the error because I was in the room and I was the one doing the testing. A less diverse team could have shipped the product and never known it was fitting an entire population of patients. And so
mm,
what I always come back to and what I think we should always remember is that bias doesn't always announce itself. It hides in
mm.
training data and design assumption and also who gets to be the default user. And so the diversity in the room isn't a nice to have, it's a must have, and it needs to be a safety mechanism. And so this is exactly where I think some companies still fall short, is because we can't treat diversity as a simple HR metric. It needs to be a fundamental product quality strategy that ships
Mhm.
product that serve diverse populations. So if your AI engineer and design teams don't reflect the most marginalized patients you serve, your AI could essentially be flying blind. And in healthcare, blind spots don't just cause bad experiences, they can also cause harm. So I challenge us here
Mm.
to really think about in our day-to-day what is missing and who is missing from this room because the right people aren't here to help really drive the solutions forward.
That's great. That's great because that I'm thinking also that it's gonna affect, obviously marginalized patients or
Hmm.
Black patients. But then I
Hmm.
think, being a product manager, I think about us being in the room building the product,
Bingo.
right?
Yep.
So, being able to have diversity in the AI zone, in the AI,
Yeah.
arena, so that when, these things are being developed, we're thinking about everyone and everything in all aspects of
Yes.
it. Um,
Yes.
yeah, that's great. Yeah, someone put one of your quotes, which I'm glad someone put it there. Bias doesn't always announce itself.
Yeah.
That is top tier right there. Thank you. So that will be a quote. That will be definitely a quote we will be using. Okay, next, to keeping things moving along. So from your perspective, right, what are the biggest risks in deploying AI too quickly in healthcare? And where have you seen technology unintentionally reinforce the very inequities it aims to solve?
Yeah. I think the biggest risk is compounding bias because we know that healthcare systems have like a deep historical inequities, and we know that technology already carries subconscious biases of the creators. And so the way I like to think about this is that when you deploy AI across both spaces without extreme care, you're not just adding these biases together, you're actually multiplying them. And when that happens at scale in healthcare, the dangers could be catastrophic because they reinforce each other in a way that's harder to detect and also
Mm,
harder to undo. And so, if you think about what I shared earlier, in one case, a system couldn't recognize Black skin because of how training data was built. And in another, the AI summary gave my father medical history like he never had. And the doctor almost prescribed medication based off of it. So these aren't theoretical risks. They're happening right now with real patients. And
mhm,
the people most likely to be harmed are the people who are already underserved by the system before AI even entered the picture. And so that is
mm,
one risk that I see. A second one is what I believe to be what I call like a false sense of progress when organizations deploy AI simply because they can, because the technology is available and the market pressure is real, but they're not actually asking the hard questions about who it serves and who it might harm. In the end, they end up creating something that looks innovative on the surface, but it hasn't actually addressed the foundation that is built upon. So the product is going to launch, the press release goes out, but the same patients are still falling through the same cracks. And I want to be clear when I say this is that I'm not arguing for slower deployment. I'm actually
mhm,
advocating for healthcare to keep innovating. But what I'm saying is that we need to be more intentional about how we deploy. And that intention means asking, like at every single stage of the process, who are we building for? Whose data trained this model? What happens when it gets it wrong? And also, who bears the cost when this fails? Because
mm,
the thing I want us to remember when it comes to AI, especially in healthcare, is that when AI fails in a consumer app, you're going to get what a bad recommendation, a bad rating. But when AI fails in healthcare, someone might get a wrong medication, someone might get a misdiagnosis. People are going to lose trust in the system entirely, and the stakes aren't comparable at all. And so, our rigor when it comes to healthcare and AI shouldn't be either.
wow. That got me thinking like, in a lot of the work that we do here, right? We're also doing research with, entities such as like CMS and our payers and things like that. Do you know if there's any like guardrails or what's there to ensure, like you said, because if AI gets it wrong in healthcare, that could
Yeah,
result in a bad medication or
yeah,
or let's just say something as simple as, I think I read like I think Cigna Healthcare is one of the companies that's putting all their authorization
yeah,
medical necessities through AI. And if that's
yeah.
denied when someone really needs that care, like, how do
Bingo.
we, like, do you know of any guardrails that's around in healthcare right now that we can be aware of?
Yeah, definitely. And that's, I feel like we're going to have a whole separate conversation on that. And I love what someone put in the chat too, as well. It quickly popped up. The ramification is someone could die. And I think it's important for us
Hmm.
to call it out. Whereas, like, if AI gets it wrong, the stakes are very, very high. It's life or death. But in terms of guardrails, there are a few, and I think it starts at the model training layer. It really starts by like our evaluation framework. It really
Hmm.
starts and continues around pressure testing what these results could look like. When we think about generative AI, it's probabilistic systems and not deterministic. So we have to be very, very careful about how we steer the model in a way in which that when we check the evaluation criteria, like we are pretty sure we are accurate in knowing that the information that we're giving to patients is almost absolutely going to be correct or beneficial, and also have guardrails in place that steer it away from giving incorrect answers to as well. It's a very delicate balance that we need to really be intentional about. I can spend so much time for us to go in detail about this, but I'll save that for another time.
Understood. Okay. All right. Keeping it moving along. The chat is very, very lively. We love it. We love it. Please put all your questions in there. We'll definitely have time at the end for them. Okay, so um, some may say we are building breakthrough technology,
Mhm.
but with a broken foundation, that's what some may say. In your opinion, how can healthcare technology companies provide a remedy for a broken foundation while continuing a breakthrough technology?
Yeah, and I think when it comes to a broken foundation, the honest answer is that the remedy has to come before
Mm,
or at a minimum alongside the solution. You can't innovate your way out of a broken foundation without first looking down and understanding what's cracked. Because the companies that will lead AI in healthcare aren't necessarily going to be the fastest builders. They're going to be the ones who are most honest about what they're building on top of and making sure that the cracks get fixed before deploying to the world. So the question then becomes, how do we think about how we fine tune, evaluate, and govern these systems in a way that
Mhm.
truly understands our unique patient clinical like systems and populations? And practical steps where this could look like is that we need to invest in diverse training data. We need to build evaluation frameworks that test for equity and not just accuracy. And we need to create feedback loops where the communities that we're aiming to serve for, we're really taking them into account and really putting them at the forefront of these systems. And also, we need to treat bias audits with the same rigor and intentionality as we do security audits. I think these are
Mhm.
fundamental shifts that need to happen for us to really start to think about how we recreate and rebuild the foundation.
That's a good point. Bias audits the same way as
Yeah.
security audits. That's very, very good. Okay. Again, moving along. So as a healthcare tech company, right? Athena is actively leveraging AI in building and improving our products to enhance our clients' capabilities and continued patient satisfaction. What are some important factors, right? Athena should consider when leveraging AI to service our products, providers, and patients to ensure we truly meet people where they are and makes equity for all.
I love this question. And I'll offer three things, and I'll frame these less as suggestions and more as responsibilities for any healthcare technology company building with AI right now. I think the first is around model literacy across the organization. I believe that understanding how the AI models work, the quality of its responses, where it's confident, where it's guessing, and how its output impacts patients cannot just be the responsibility of AI scientists anymore. It's everyone's responsibility now. Product managers, designers, clinicians, staff, leadership. If you're shipping products that AI is at the center and that it touches patients and clinicians, understanding the model isn't optional. It's a baseline requirement for your role. And I'm going to even push this further where I urge everyone to start reimagining what their own workflow looks like when they
Mhm.
deeply understand not just what they're building, but also how the model how the model is powered and how it actually works because our jobs are changing. The differentiator now going forward won't just be who builds the best product, it's going to be who truly understands the full stack from the model all the way to the end patient experience because you need to know the model and the patient experience so well that you can detect where across the stack is it not serving someone equitably. And I think
Mhm.
the second thing that we need to really focus in on is designing for edge cases first. In a world where AI has made it incredibly easy, where you can go from an idea to prototype faster than ever, there's a real temptation that I'm seeing to optimize for the majority and plan for the margins later. But in healthcare, the margins are where like the stakes are the highest. So the patients most likely to be harmed by AI's failure are going to be the same patients who historically has been underserved by the system. So if your AI works for the most complex and most underrepresented patients, it's going to work for
Mhm.
everyone. But if you design for the center and hope it extends out to the edge, you're going to lose people and as someone said in the chat, like if you lose people, it's not just a churn metric, it's a life. And so I think we
Mhm.
really need to spend time really internalizing and focused on that. And now the third piece that I'll offer to as well is for us to really take time to understand the limitations of AI because
Mhm.
healthcare is high stakes across the entire stack. So every team building with AI needs to deeply understand not just what the product can do, but also where it breaks and how we handle when a patient encounters error. What happens when a clinician's overtrust the summary? Like when we think about like the stories that I've shared earlier, I really want us to really think about us to design for this in the very beginning before the first line of code is even written. So my challenge for everyone in this room is don't just ask, does the AI work or is our product ready to be shipped? We need to start asking more fundamental questions about like how was this data trained? How do we think about the orchestration layer? When does it fail? Who does it fail for? What happens when it does this, right? Because your voice and in the room could really make the
Mhm.
difference between building an AI that's just simply like efficient versus building AI systems that are also equitable.
That's a great point. It's a lot. Just had me thinking about a lot of stuff, a lot of things. So before we get to our questions, one more question for you.
Yes.
from the team here. Lastly, can you share any exciting initiatives or work that you're currently involved in the AI healthcare space?
Yeah, so there's a lot of things on the horizon, some that I can talk about and some that I can't, but I'll share what I can. And what I can say is that, and across my advisory work in my day to day, I've been really focused and intentional about designing and building what the next era of human AI interactions will look like, really reimagining what this new paradigm will be. Because if we believe that AI agents are going to be prominent in our day-to-day lives, we need to start recreating these workflows so that they just don't run on autopilot. We need to start building systems that keep the human above the loop and give the clinicians power to really orchestrate care and also give patients transparency to really trust the process. And so I've been really focused on thinking about what this new paradigm could be and getting healthcare companies ready for that. I would say outside of that, I've been also been advising a few companies around like responsible AI and helping them think through how they measure quality, how they think about designing for equity, and also asking the hard questions before they ship. I would say I'm really passionate about this work because I think we're in such a unique window right now where the norms are being set. I believe that the standards that we establish today for how AI is built is going to define the next decade, and I want to make sure that the right voices are shaping those standards. And for me, on a personal note, one of the things that I've been really passionate about, and you hinted at this a little bit earlier, is I've been really focused on the intersection of education and healthcare for marginalized
Mhm,
communities because
mhm,
I deeply believe that equipping people with an understanding of how AI works in itself is a health intervention. So if a patient doesn't understand what an AI summary is doing, then they can't catch when it's wrong. And so I
mhm,
really want to make sure that communities understand how their data are being used, how they can advocate for themselves, because we're going to see more and more health literacy and tech literacy are going to become inseparable. And the communities that don't have access to both are going to fall farther behind. And again, I really want to help close that gap because when I really reflect on my purpose and what I've been doing in the healthcare space, it really comes back to the core question and my father's experience that was planted in me, which is that when we think about technology, right, I want to ensure that it's making people's lives better and making sure that it's being provided to the people who need it the most. And if the answer isn't a clearly yes, then I know that I have more work to do.
Great, great, great. So before we get to our questions in the chat, I just have a quick question. How's your father doing?
Oh, he's doing great. He's doing great. He
Okay.
wished me good luck before this. He said he can't wait to see the recording. So I was just on the phone with him right before this. So it was
That's
great.
wonderful. I love to hear it. I love to hear it. I know he must be extremely proud. Okay. So Heather, do you want to read off some of our first question?
Yeah, let's do it. So this was somewhat answered, and it's also similar to a more recent question asked. But Brett Pickus was wondering, how can we stop AI from becoming biased, especially in ways that harm underserved communities by worsening existing healthcare inequalities or distorting data? I feel policies are important to regulate this and how we use it. And I will say at Athena Health, we do have drafted policies from our core AI team. It's a team of engineers, but that hasn't been largely exposed.
Yeah, so I love that question. I think there's a few different ways. I think policy is one of it. For me, like as a researcher who like plays across like the full tech stack, I think it's having uncomfortable conversations, which like something I've had to grow into, which is really understanding that how is this like really focused on the training data, really starting to assess and really have evaluative frameworks that try to assess across these different paradigms, across how these data are going to be used from pre-training to post-training, where can we detect bias early on? How can we start to shape the product in a way that we're not going to ship if we know that it's not serving for every single community that we need? We need to have a score. We need to have different metrics that says that, hey, when it comes to these type of patients, our model is actually scoring lower across these different dimensions. We can't ship this yet. And we actually need to focus on testing a real patient before we deploy it. So that is something that I would say that from like a very tactical, like AI training data standpoint that we should be heavily focused on. And something that I alluded to earlier, it's not just the responsibility of the AI scientists. It's going to take everyone in this room really advocating for that and asking those questions. Or if you see something, call it out and be like, no, I noticed that when it comes to this data sets, It's inaccurately
Mhm.
representing these groups of people. What are we doing about it? We can't just be like, oh, we're going to ship it and we're going to fix it later. It's like, no, like I'm going to keep escalating this until we solve for this. Because I think so many times in the tech world, we focus so much on shipping fast that we're not understanding who we're leaving behind as we're moving fast. And I really want us to take a step back to really make sure that the products that we're building aren't leaving people behind.
That is such a great point. And I know that we have very excited people on the director level and above who are looking at our new pipeline for developing AI features. So great. We have another question this time from Andy Wessels. Bigger question. How can AI be leveraged when there is an answer but a physical limitation? This is interesting. For example, a heart attack needing a cath lab and being in either a marginalized community or very rural area. You get a proper answer, but a lack of a cardiologist or the equipment needed to perform the procedure, and the patient can't be transported. So information
Yeah,
ahead of, right, ahead of the
yeah,
capability. Yeah.
yeah, that is. Thank you for asking that question. And I think that's where the opportunities lie for us to think about, especially in healthcare, what it is that we need to build next. With that question, and I'm just gonna like repeat it back of like, hey, you know that you have this diagnosis, but you live in a rural area, getting to the hospital is extremely challenging. And I think that's one of the ways in which I think we need to also focus on building more in-home based systems that don't replace the doctor or replace like the therapist, but more so in a way act as a middle ground in which like someone can get the proper care or the resource that they need while we figure out and utilize AI to get them the support that is needed. I think when we think about how AI is going to shape like the physical world, that's something which I think we need to start with first. It's not necessarily thinking about us creating robots or for us to think about how we create these cyberhuman systems that already sit at these major hospitals, right? Because the people who are going to these major hospitals can afford to go to these major hospitals. But how do we think about building and recreating in-home systems across many different diagnoses in which can sit at home and actually help these patients? I think that's a huge opportunity. I don't think we're spending enough time talking about that, but in the few conversations that I've been in, I know there's teams that are working on this across the horizon for the next 5 to 10 years. So I'm excited to see what gets built out in these worlds.
Thank you. That's definitely something I'm going to be looking into too. So thank you, Andy, for the question. From Danny Norden, um, tips for getting people to understand AI that isn't, sorry, tips for getting people to understand that AI isn't a magic stick you can beat a feature with and make it go. More seriously, the quality and labeling or naming of underlying data makes a huge difference in the quality of the output. And too many folks end up thinking that the newer models don't need you to have clean underlying data to work well. I was thinking of this as well. Clean data is almost the groundwork, right?
Yeah. Yes. Yes. 1,000%. I think when we focus in on like how we train our models and how we like build out these systems, if you don't have clean data sets, it's like your model's not going to be good. Like it's just something in which like you really need to spend a lot of time focusing on, even with human annotators too as well. And I think another key principle here that I want to push teams to do more of is just like having those core experts in the room and thinking about how we really bring out explicit knowledge into these data sets too as well, where it's just like we're not thinking about things from like the general standpoint. Because when we look at AI, it really shrinks to like the medium, right? But there's a lot of expertise that sits at the 1%. It's like, how do we bring those into the data sets and have those really steer the model in a way in which you know that every time you're chatting with an AI system in healthcare, you're getting the expert knowledge of the top 100 best clinicians in the world, and you know that this is
Mm.
trusted. I think there's more we can do with like the data sets and making sure that we're fine tuning and we're also recreating an approach in which like the response that we're giving is hyper personalized and it's made across different expertise in different domain spaces.
Good. Yeah. To your point earlier, bringing people in, we have something called an advisory board here with clinicians
Yeah,
on it, and adding them to a step in the process before revealing to all of our users. Right.
I love that.
Yeah. Sherelle, good to see you in the chat. It's been a while. From Sherelle Rivers, I would like to know how would you suggest providing AI literacy to patients that already do not trust and do not have consistent access to technology? You touched on this a little bit. I'm very interested in this as well.
Yeah, this is tough, and I think it really starts, it's across two folds, and I've seen it play out in both directions. I think for one, when we think about healthcare, and there's something in health, there's something that I truly believe is that it doesn't just start in the hospital, it starts in the home, in the neighborhoods, right? And if
Mhm.
AI systems that we build only see what happens between the four the four hospital walls, we aren't pushing the boundaries enough to actually solve the problem. And so, to me, where I think we can really focus on AI literacy is really thinking about how we start to understand why are you like hesitant to use these tools? Like we know why, but we want to really hear it from like the patient's voice and understanding across the stack, how do we build scaffolding and moments of delight in which allows them to trust? It's not going to be a one-shot thing in which like, oh, I introduced this new system to you, you're going to trust it. But it's understanding it's like how do we start to recreate and redesign adaptive tools that really sit at what the patient needs. I think one of the ways in which like this showed up for me was when I was testing at the Shirley Ryan Ability Lab. I was talking to two Black patients, and they were telling me like this was before we even like launched it. They're like, I don't like how this app looks. It's not designed for me. There's certain contexts that it's not really accounting for. Like, we're gonna test this tomorrow. They're like, oh, I'm very skeptical of this. I remember I spent 2 hours with them just kind of doing like, all right, break it down for me. What don't you understand about this? What can I really help you see that, okay, no, it does this. These are the constraints. Here's how it helps you. And there are also some things they said to me that were very valid about just even our whole approach into these systems. And I remember that I went home, got on my laptop, started recoding the system to really be adaptive to the things that they said to me early in the day. Remember when we tested the system, one of the many joys that I got from it, they're like, you took my feedback into consideration. Like you're actually allowing me to trust these systems a lot more. Like, thank you for that. They're like, I've never seen someone take the things that I'm saying about this tool and all of a sudden it looks like what I'm telling to do. And like you're explaining the things in a way that makes sense to me. They're like, thank you for that. And so I think one with that the first step is really taking the time to understand what are the limitations, what are the fears, what are the things that people are skeptical when it comes to AI. And then for us to use the tools and resources that we have in place to really help them and really recreate those experiences. Because if we're just building from our own intuition, we're going to miss a lot of people.
All great points. Something I'll take to heart as a UX researcher and designer. Something that you said was you remember you spent 2 hours with them, right? So
Yeah,
we have to get people, not just us, like Athenistas being diverse in the room, but bringing a diverse community into the room as
bingo.
well. If anyone wants to talk more about an interesting story about COVID-19 and getting into communities regarding trust, please hit me up on the side because I have something that relates to that. Okay, from Veronica Brown, what practical steps in the tech industry, what practical steps is the tech industry taking to address the environmental impact of data centers? How do we as the public interact with the industry and our local governments to ensure we do protect our environment and the marginalized communities where data centers are most likely to be built? This is close to home. Some news just came out of San Marcos, Texas, which I'm near to today.
Yeah, I think this is very, very important and very timely. I think one, it understands it comes from us, like from policies too as well, because I believe that if there's no guardrails, like truthfully, just like me being honest, people are just gonna fly and just like do whatever's needed. So there needs to be like guardrails and policies that are in place. That's one. I think two as well as when we think about the resources that these models are using. I think we, from like a tech standpoint, need to get better about how we steer the model into making sure that we're using this where it's like we don't need to use the most complex model to solve this problem, right? We can think about using smaller scale models that don't impact the environment as much, but still gets the answer that's needed. So I think that also needs to be a shift and not just building the biggest and largest data set just for the sake of, but understanding it's like how do we create smaller data sets? How do we create smaller models that solve for particular use cases? I think that's going to be very fundamental in helping really reduce the environmental impacts.
That is such a great point. There's little things we can do every day, like not using the, deepest thinking,
Yeah,
deepest researching model to answer a certain question. That was the last question from the chat. Thank you so much.
Oh,
thank you.
okay. I thought, oh yeah, we do have one. Yes. Thank you. Yeah, that was the last question. Well, I will say this. I know we're almost at time, a little bit of time. Are there any parting words that you can leave us with, Doctor, that, you know, I feel like everything that you've said so far, we're taking it, we're digesting it. Like I said, we're very much AI forward. The chat has been very lively with a lot of these points and discussions. One of the things that sticks out to me, that the last thing that both you and Heather were talking about is, it's the trust, right? It's not just in the
Yeah,
trust in the data, but I also want to get your feedback on like education of the historical mistrust within
yeah,
the Black community in particular, right? Someone put in the chat about, Tuskegee, the Tuskegee experiment, right? We
yeah,
know historically things with like Henrietta Lack, right? We know all these, historical healthcare stories that impacted the Black community. But what happens when, the clinicians that are treating these communities don't know those stories and don't know where the mistrust comes from?
yeah.
So, how do you think we can, leverage AI in a sense to kind of marry the mistrust and give us some trust and not just
Yeah.
AI, but in healthcare and clinicians overall.
Yeah, no, thank you for sharing that. And I think that is so timely and important. And the one thing that I would say, and I'm going to add this to the parting words, is like I want us all here to walk away with like a deep conviction. And like I see it through the chat, I see it through our conversation. Like we know it, AI in healthcare is not neutral, right? It's not. And I know a lot of people like to think that it is. It inherits the inequities that the system that is built upon. And so we have a moral responsibility to really actively think about how we're researching, designing, and building out these solutions, but also how we educate people on this, like how we make sure that we might not be in every single room. So how do we make sure that information is sent over to those rooms so they have this
Mhm.
top of mind? We need to think about it from that lens. Also, we need to think about it from like the end user experiences too, as well. It's like there's going to be a lot of people who don't trust these AI systems, especially when it comes to
Mhm.
healthcare. And so it's like, how do we, again, like from what I said earlier, it's like, how do we take the time to really give them the information to understand here are the guardrails, here's what it can do, here's where it fails at. And if you have any concerns, here's how you have a direct support line to helping shape what this product looks like too as well. I think that's also going to be very important. So I don't want us to shy away and think that all of a sudden, because we have AI, healthcare is going to be just net neutral, it serves everyone. No, it's going to be something that we actively have to do. And as AI is shaping the next decades to come, I think again, we're in such a pivotal moment right now in which the decisions that we make today is going to impact the lives for years to
Mhm.
come. So it's very important that we take this very seriously.
Thank you, thank you, thank you. Well, this has been an amazing, amazing discussion. I know you felt a little bit of pressure because I
Yeah.
told you we had great events before, but you did amazing. You knocked it out
Thank
the
you.
park.
Thank
Trust
you.
me. I just want to share. I had the amazing opportunity of hearing you at Afrotech. So that's how we met,
Yep.
virtually. And then, I reached out for you to come and educate us. So is there any particular social that we can find you so we can follow you? Because you hinted that you got something working on in the background, but you
Yeah.
can't share. So
Yeah. I would say Instagram and LinkedIn. One of the things I'm going to be more active in this year is like posting more, and I have a lot of things on the horizon. So across those
okay.
two socials, I'm going to be like sharing a lot more of this journey that's happening. And also, thank you for the Game Boy comment. It just popped up on my thing.
Yeah. Yeah. Yeah, that's nostalgia, but it does it work?
It's a Lego set, actually. Yeah.
Oh, okay. Of course you would be into Legos.
Yeah.
Absolutely, absolutely. Even better, exactly. Well, thank you again so much for this. I greatly appreciate it. We will be
Thank you.
sharing the recording for anybody who couldn't make it, and I will share it with you so you can tell your father you did an amazing job. Okay, and we wish him all the best. And to everyone on the call, please fill out our survey. Athena Mosaic will love to hear your feedback on our events. We definitely will. And thank you, Heather, for monitoring the chat and the questions. Once again, thank you, Dr. Love the discussion, and hopefully we'll see you again.
Sounds good. Sounds good. Thank you all for having me. Happy Black History Month.
Happy Black History Month. Thank you.